Countering philanthropy critiques. Critics, including Via Africa, accuse the Gates Foundation of promoting corporate interests, particularly in agriculture, e.g. through AGRA. Praising Traoré, a populist anti-imperialist leader, aligns Gates with a respected African figure, mitigating perceptions of neo-colonialism. This aligns with Gates Foundation's broader efforts to engage with grassroots leaders, such as its partnerships with community health networks in Kenya and Senegal. Ensuring partnership continuity. Recognizing Traoré ensures continued access to Burkina Faso, a key partner for the Gates Foundation's $100 million health and nutrition programs annually. Traoré's non-interference in foundation operations contrasts with Mali, where coup leaders restricted NGO activities, complicating aid delivery. The endorsement strengthens ties with Burkina Faso's health ministry, facilitating future initiatives like the malaria vaccine scale-up planned for 2026. Advocating for global health investment. Gates' praise is part of a broader advocacy push, as aid declines globally. By highlighting Burkina Faso's resilience, he underscores the need for donors to prioritize countries with strong leadership, influencing G7 and World Bank strategies. The Foundation's $200 billion commitment to Africa is framed around success stories like Burkina Faso, encouraging other donors to match its investment. Strategic framing. The Gates Foundation's endorsement is timed to coincide with global health challenges, including a $10 billion aid shortfall in Africa in 2025. By framing Burkina Faso as a model, Gates counters narratives of African dependency and reinforces the Foundation's role as a partner, not a director, in global health. Traoré's alignment with Sankara's legacy adds symbolic weight, appealing to African audiences and policymakers who value historical sovereignty. Lessons for nations like Nigeria. Burkina Faso's health sector reforms under Traoré offer actionable lessons for Nigeria, Africa's most populous nation, which struggles with health disparities, weak governance, and persistent health challenges like polio, malaria, and high maternal mortality. 512 per 100,000 live births in 2020. Prioritize institutional continuity. Lessons. Prioritize continuity. Nigeria's frequent turnover of health ministers since 2020 disrupts programs, delaying polio eradication and vaccine rollouts. Burkina Faso's retention of leadership suggests Nigeria should stabilize health leadership to maintain trust with donors like Gavi and WHO. Action. Nigeria could establish a bipartisan health policy framework to ensure continuity, similar to Burkina Faso's approach. Invest in community health systems. Burkina Faso's mobile clinics and CHWs and WASHs provide a model for Nigeria's northern regions, where only 30% of children access healthcare regularly. Nigeria's 100,000 CHWs could be scaled to 200,000, focusing on immunization and maternal care. Action. Nigeria's $2 billion primary healthcare revitalization program, 2023 to 2027, should prioritize mobile units and local hires to reach for Boko Haram affected areas like Boko Haram affected areas. 3. Reduce aid dependency. Nigeria relies on $3 billion in annual health aid, covering 50% of its health budget. Burkina Faso's domestic funding, 13% of GDP, and local production suggest Nigeria should increase health spending, currently 5% of GDP, and invest in local drug manufacturing. Action. Nigeria could expand its pharmaceutical sector, like Burkina Faso's, leveraging facilities like the Emzer and Fitson plants to produce generics, reducing import costs by 20% annually. 4. Integrate local solutions. Burkina Faso's use of traditional medicine and community engagement boosted trust. Nigeria could incorporate traditional healers into primary care, particularly in rural areas like Kano and in Sokoto, where cultural barriers limit uptake. Action. Pilot programs training traditional birth attendants as midwives, as in Burkina Faso, could increase skilled birth attendants by 15%. 5. Leverage regional cooperation. Nigeria, as a leader in ECOWAS, could emulate Burkina Faso's AES health initiatives by proposing a West African vaccine procurement pool, reducing costs and enhancing supply chains. Action. Nigeria could lead an ECOWAS health fund, modeled on the AES, to finance regional health projects, drawing on its $500 million health diplomacy budget. Challenges for Nigeria. Nigeria's challenges include corruption, health funds, 20% of health funds lost into 2023, insecurity, and ethnic divisions, which complicate reforms. Unlike Traoré's centralized authority, Nigeria's federal system requires state-level buy-in, delaying implementation. Lessons from Burkina Faso suggest Nigeria must prioritize transparency, perhaps through blockchain-based fund tracking, and engage local leaders to build trust. Conclusion. Captain Ibrahim Traoré's health sector reforms in Burkina Faso have transformed the health landscape of Burkina Faso, showcasing a model of resilience, equity, and sovereignty. His reforms, retaining leadership, expanding primary care, leveraging local resources, and increasing domestic funding, have sustained health progress despite conflict. Bill Gates' endorsement reflects the Gates Foundation's strategic strategic alignment with Burkina Faso's FASO, highlighting its resilience and advocating for African-led solutions. These reforms have far-reaching implications for Africa's future, offering a blueprint for health sovereignty and crisis management. For Nigeria, the lessons are clear. Stabilize leadership, invest in community health, reduce aid dependency, integrate local solutions, and foster regional cooperation. As Africa navigates a future of declining aid and rising challenges, Burkina Faso's transformation under Traoré stands as a testament to the power of visionary leadership in achieving health equity and sovereignty. Additional notes on health sovereignty. To further elaborate on health sovereignty is particularly resonant in the context of Africa. It's worth noting that Traoré's reforms tap into a continent-wide movement. The African Union's Agenda 2063 for 2063 and the African Medicines Agency (AMA), launched in 2021, aim to reduce Africa's reliance on drug imports by 2030, fostering local research and production. Burkina Faso's Made in Burkina Faso initiative aligns with AMA's goals, positioning it as a leader in this space. However, the challenge lies in scaling these efforts, as Africa faces a $4 billion shortfall in health research funding annually. Traoré's hybrid approach, leveraging global partnerships while building local capacity, offers a pragmatic path for other nations like Nigeria, which struggles with a $2 billion health funding gap. Gates' long-term vision. Gates' recognition of Traoré is also a signal of his long-term vision for Africa's health sector. The Gates Foundation's $200 billion commitment includes plans to establish 5 African-led research hubs by 2030, focusing on vaccines and diagnostics for diseases like malaria and HIV/AIDS. Robust health system performance. Gates described Burkina Faso's health system as pretty decent in stable areas, citing sustained vaccination coverage, 90% for DTP3, and low-cost primary care delivery, $5 per capita annually. This contrasts with regional peers like Niger, 80% DTP3 coverage, and Mali, 75%. The Foundation's data shows Burkina Faso reduced under 5 mortality by 5% from 2022 to 2024, despite conflict, aligning with global health targets. Effective local partnerships. Colin Basinga, the Gates Foundation's global director, highlighted collaboration with local NGOs and CHWs, which Traoré's government supported. For instance, the Foundation's nutrition program, distributing fortified foods to 500,000 children annually, relies on these networks. Traoré's community-focused approach mirrors the Foundation's bottom-up strategy, enhancing program sustainability and scalability. Alignment with Foundation priorities. Traoré's focus on maternal and child health, nutrition, and infectious disease control aligns with the Foundation's $200 billion 20-year commitment to African health 2025 to 2045. Burkina Faso's progress in these areas makes it a flagship case for Gates advocacy. The malaria vaccine rollout, supported by the Foundation, reached 70% of target populations in Burkina Faso's pilot regions, exceeding expectations and prompting Gates' praise. Resilience in a fragile context. Gates noted Burkina Faso's ability to sustain health progress amid jihadist violence and aid cuts. Western aid dropped 30% since 2022. This resilience contrasts with Nigeria's northern regions, where polio and measles outbreaks persist due to insecurity and weak governance. The Foundation views Burkina Faso as a model for health system adaptation in conflict zones, informing its strategies in Somalia and South Sudan. Context of Gates' endorsement. The Gates Foundation has invested over $500 million in Burkina Faso since 2000, focusing on health, agriculture, and nutrition. Its endorsement of Traoré is strategic, aimed at reinforcing partnerships and countering critiques of Western philanthropy as neo-colonial. Gates' June 2025 remarks were partly a response to global health challenges, including a 20-year low in foreign aid and rising vaccine hesitancy. By highlighting Burkina Faso, Gates underscores the importance of African-led solutions in a shifting aid landscape. What this means for Africa's future and health sovereignty. Traoré's health reforms offer a blueprint for Africa's future, particularly in achieving health sovereignty, the ability of nations to control their health systems, prioritize local needs, and reduce dependency on external actors. These reforms have continent-wide implications, especially as Africa faces declining aid, rising populations, and persistent health challenges. Implications for Africa's future. Blueprint for crisis-resilient health systems. Burkina Faso's ability to maintain health services post-coup demonstrates that political transitions can coexist with health progress if institutional continuity is prioritized. This model is relevant for countries like Sudan and Ethiopia, where conflict disrupts healthcare. The use of mobile clinics and CHWs offers a scalable strategy for reaching displaced populations, applicable in refugee-heavy regions like East Africa. Advancing health sovereignty. Traoré's emphasis on local pharmaceutical production and traditional medicine reduces reliance on imported drugs, a critical step toward health sovereignty. Africa imports 70% of its medicines, costing $14 billion annually. Burkina Faso's approach could inspire similar initiatives in Ghana or Kenya. Domestic health financing, 13% of GDP, sets a precedent for prioritizing health budgets budgets, challenging aid-dependent nations like Uganda, 5% of GDP, to reallocate resources. Regional health cooperation. Traoré's leadership in the Alliance of Sahel States, AES, with Mali and Niger opens avenues for regional health collaboration. Shared vaccine procurement, cross-border disease surveillance, and joint training of CHWs could enhance collective resilience, mirroring ECOWAS health initiatives. A proposed Sahel Health Fund, discussed in 2024 AES summits, aims to finance regional health projects, reducing dependence on Western donors. Empowering youth and local leadership. At 34, Traoré represents Africa's youth, who constitute 60% of the continent's population. His reforms, rooted in Sankara's legacy, inspire young leaders to demand accountable, people-centered health systems, as seen in Nigeria's #EndSARS movement. Community-driven health initiatives foster civic engagement, strengthening social cohesion and countering alienation among urban youth. Navigating global health shifts. With foreign aid projected to $10 billion annually for Africa by 2030, a 20-year low, Burkina Faso's self-reliant model offers a path forward. Gates' warning of aid cuts underscores the need for domestic innovation, such as Rwanda's drone-based medical delivery, adapted to local contexts. Traoré's reforms highlight the value of strategic global partnerships, balancing sovereignty with collaboration to access vaccines and technology. Health sovereignty in context. Health sovereignty involves financial autonomy, cultural relevance, and policy control. Burkina Faso's integration of traditional medicine and local production aligns with the African Union's 2007 strategy to promote indigenous health solutions. However, reliance on Gates Foundation programs, 10% of health program funding, and Gavi vaccines underscores the challenge of full autonomy. The continent must navigate tensions between global health agendas, e.g. WHO's universal health coverage, and local priorities. Traoré's reforms suggest a hybrid model, leveraging international support while scaling domestic capacity, a strategy applicable to pandemics or climate-driven health challenges. Why Gates is giving special recognition to Traoré's reforms. Gates' special recognition of Traoré's reforms is deliberate, reflecting pragmatic and symbolic goals. It positions Burkina Faso as a success story while advancing the Gates Foundation's strategic objectives in Africa. Specific reasons for special recognition. Showcasing African leadership. By praising Traoré, Gates amplifies the narrative of African-led solutions, critical for the Foundation's credibility amid critiques of Western-driven philanthropy. For instance, Burkina Faso's health system is cited in the Foundation's 2024 Goalkeepers Report as a model of country ownership. Traoré's reforms align with Gates' advocacy for empowering local systems, contrasting with scalable, sustainable health models like those in Rwanda and Ethiopia, where government-led initiatives drive progress. Highlighting regional contrasts. Gates contrasts Burkina Faso's stability with Nigeria's northern regions, where vaccine coverage lags 50% in some states and polio persists due to weak governance and insecurity. This comparison underscores the need for effective leadership, with Traoré as a positive example. The Foundation uses this to call for increased investment in Nigeria, where the Gates Foundation has committed $2 billion to primary healthcare 2020 to 2030, but faces implementation challenges. You won't believe what Bill Gates just said about Burkina Faso. The billionaire philanthropist has praised Captain Traoré's game-changing health reforms, and the world is finally paying attention. Breaking. Tech mogul and global health advocate Bill Gates has just praised Burkina Faso's healthcare revolution, calling it one of the most inspiring models in Africa. Under the leadership of Captain Ibrahim Traoré, the country has redefined public healthcare access, stunned global experts, and won recognition from one of the world's most influential voices. In this video, we break down how Traoré's policies transformed Burkina Faso's health sector, why Bill Gates is publicly applauding these reforms, what this means for Africa's future and health sovereignty. This is not just about Burkina Faso, it's a story of a continent rising with bold leadership and smart policies. Subscribe now to follow stories that mainstream media won't show. Burkina Faso's health sector transformation under Traoré, a comprehensive analysis. How Traoré's policies transformed Burkina Faso's health sector. Since seizing power in a military coup on September 30th, 2022, Captain Ibrahim Traoré has spearheaded transformative reforms in Burkina Faso's health sector, drawing heavily from the revolutionary ideals of Thomas Sankara, 1983 to 1987. These reforms aim to strengthen primary healthcare, enhance access to essential services, promote equity, and reduce reliance on foreign aid, aligning with Traoré's vision of national sovereignty and self-reliance. Detailed reforms and initiatives. Retention of health sector leadership. Traoré's administration retained experienced health officials, including the Minister of Health, Dr. Robert Lucien Cargogu, who has served since 2021. This continuity ensured stability during the political transition, maintaining trust with international partners like the Bill and Melinda Gates Foundation, Gavi, and the World Health Organization, WHO. The retention of technocrats prevented disruptions in ongoing health programs, such as vaccination campaigns and maternal health initiatives, which are critical in a country facing security challenges from jihadist insurgencies. Expansion of primary healthcare infrastructure. Traoré prioritized community-based healthcare, particularly particularly in rural areas where over 70% of Burkina Faso's 22 million population resides. The government constructed and refurbished over 200 health centers in 2023 to 2024, focusing on underserved regions like the Sahel and S. Mobile health clinics were deployed to deliver services in conflict-affected areas, providing vaccinations, prenatal care, and treatment for common diseases like malaria and diarrhea. These clinics reached approximately 1.5 million people in 2024 alone, according to government reports. Community health workers, CHWs, were trained and equipped, increasing their numbers from 17,000 in 2022 to 22,000 by mid-2025. CHWs focus on health education, disease prevention, and basic care, bridging gaps in remote areas. Maternal and child health programs. The administration launched the Mother and Child Health Initiative in 2023, aiming to reduce maternal mortality 330 per 100,000 live births in 2020 and under 5 mortality 88 per 1,000 live births in 2020. The program includes free prenatal and postnatal care, skilled birth attendants, and distribution of fortified foods and micronutrient supplements. In 2024, Burkina Faso achieved a 10% increase in skilled birth attendants, reaching 85% in stable regions. Vaccination coverage for children under 5, including measles and polio, remained above 90%, defying regional trends of declining immunization rates. Integration of local knowledge and resources. Traoré's policies emphasize using locally produced medicines and traditional remedies alongside modern healthcare. For example, the government partnered with local herbalists to develop standardized treatments for common ailments, reducing import costs by 15% in 2024. The Made in Burkina Pharmaceutical Initiative promotes domestic production of generics such as anti-malarials and antibiotics at facilities like the Ouagadougou pharmaceutical plant. This reduced reliance on imported drugs, which previously accounted for 80% of the market. Public health campaigns and disease control. Mass vaccination campaigns targeted malaria, pneumonia, and diarrheal diseases, which account for over 50% of under 5 deaths in Burkina Faso. In 2024, over 2 million children received malaria vaccines through a pilot program supported by Gavi and WHO. Public health awareness campaigns, broadcast via radio and community gatherings, educated citizens on hygiene, nutrition, and disease prevention. These efforts reduced malaria incidence by 8% in stable regions between 2023 and 2024. The government strengthened disease surveillance systems, improving early detection of outbreaks like meningitis and cholera, which are recurrent in the Sahel. Health financing reforms. Traoré increased the health budget from 10% of GDP in 2022 to 13% in 2025, prioritizing domestic funding over external aid. This included subsidies for free health care for children under 5 and pregnant women, benefiting over 3 million citizens annually. A health insurance scheme piloted in 2024 covers 500,000 low-income households, reducing out-of-pocket expenses, which previously accounted for 40% of healthcare costs. Impact of reforms. Resilience amid crisis. Despite jihadist violence displacing 2 million people and closing 20% of health facilities, Burkina Faso's health system maintained functionality in stable regions. Vaccination coverage and maternal health services remained comparable to pre-coup levels, a feat praised by global health experts. Equity and access. Rural communities, historically underserved, saw a 20% increase in healthcare access due to mobile clinics and CHWs. Women and children benefited most, narrowing urban-rural health disparities. Economic benefits. Local pharmaceutical production created 1,200 jobs and saved $10 million annually in import costs, supporting Traoré's economic sovereignty agenda. Public trust. Community engagement and free healthcare policies boosted trust in the health system, with 65% of citizens reporting satisfaction in a 2024 government survey, up from 50% in 2022. Why Bill Gates is publicly applauding these reforms. Bill Gates, co-founder of the Bill and Melinda Gates Foundation, has publicly praised Burkina Faso's health sector resilience under Traoré's leadership, notably during a June 2025 roundtable hosted by the foundation. This endorsement reflects the alignment of Traoré's reforms with the foundation's goals and Burkina Faso's strategic importance in its African portfolio. Detailed reasons for Gates' praise. Continuity in health governance. Gates emphasized that retaining health leadership post-coup ensured program continuity. For example, the Gates Foundation's $50 million investment in Burkina Faso's primary healthcare 2018 to 2025 faced no disruptions, unlike in Mali and Niger, where coups led to aid suspensions. The foundation's trust in local partners, like the Ministry of Health, was reinforced by Traoré's non-interference in technical operations, allowing efficient delivery of vaccines and nutrition programs.